Welcome to Quiet Storm's Corner. Happy holidays to those of you who celebrate, and happy restful days for those of you who don't. Today, I want to talk about racial disparities in healthcare. The purpose of one of the reasons why I'm bringing it up today, of all days, is because earlier today there was a conversation in one of my professional groups about the purpose of social justice in healthcare. And in this group, there's a lot of very privileged people who come with a lot of power and who really didn't understand what was the purpose of social justice being incorporated in healthcare. And for me, these are people who I highly, highly respect. They've been pioneers in some of the work that I've done. However, I really did not understand how they could even question how social justice should not be incorporated in healthcare because it's part of the foundation of all the work we do. If you want to be if you want to be an ethical clinician, having equitable and some type of understanding of equitable access to care is important. So, with that being said, the first thing I always want to start with is our country has been founded on the oppression of black bodies. Point blank, bottom line. If you had a drop of African in you, you were considered a slave in this country. And that doesn't just disappear just because the Civil War happened. We've had Jim Crow, we've had experimentations on different people's bodies, we've had tons of research done exploiting black bodies specifically. So before we can just say, oh, what's the purpose of social justice? Let's keep in mind that from our earliest foundations, we have always been experimenting and exploiting African American bodies, as well as many other groups of color and people who have economic disparities in this country. So, I find it very disappointing that I have people who are extremely educated and knowledgeable and powerful who do not understand this. With that being said, I want to talk about just even becoming a professional and as a therapist, as a certified sex therapist. It is not an easy road if you do not come from money. It is not an easy road if you do not have family members who have been along this same type of road in some form or fashion, whether you had family members who are clinicians, family members who are physicians, family members who who had access to provide to help you along this journey, because it's not an easy journey. Even when we have in Nashville, Meharry Medical College, and it's where tons of physicians were created who were of African American descent, specifically because they weren't allowed to be in medical school anywhere else. There is a clinic called Matthew Walker, who's named after a brilliant heart surgeon who's African American. And I was talking to one of his family members. Shout out to that family member. I try not to disclose names. And he was saying that back in the day when people did not want him, white people didn't want him to perform on them. So what they would do is when they would be put under, they would have a white doctor put them under, and then Matthew Walker would come in, do the surgery, and then have to walk out. So, and they would bring back the white doctor to show because most people didn't want to be touched by someone who was African American in that way. So that just kind of shows you that not only as a patient are you kind of looked negatively on, but even as a clinician, someone who has tons of knowledge, people don't respect and trust you. So just kind of saying all around, there's a lot of different work that has to be done. And we've had Jim Crow laws that have been preventing people of color from being in so many different areas. There were so many laws against Jews during different times to prevent them from being medical providers. And we still have a long way to go. It does not end just because MLK said a speech. It did not end in the Civil War. It is still going on today. Black women specifically are dying at just terrible rates when it comes to maternal health care. When it comes to mental health, a lot of people of color are more so mandated into the system versus actually having access to have care by their own choice and free will, because the choices are very limited and they're very expensive. So again, it's this, we all need to be aware as consumers, as people who are professionals, as people who are educators, that there are issues when it comes to racial disparities and economic disparities in healthcare. Everyone should have a right to have access to at least bare minimum basic education on how to take care of themselves. But that's not happening across America. It's not happening across the state. Even for me, I live in Tennessee, and I am the only person of color physically in the state. Physically in the state that is a certified sex therapist. That's not acceptable. It's not okay. And we need to change this. We need to change the way our healthcare system has been preventing people of color from getting care over the years. We have to change the way our healthcare systems have been preventing people with economic disparities from getting care over the years. It should not be something that we are arguing over. It should be something that's just a basic human right. And because some of you may celebrate Christmas, I think it's something important for us to talk about now, because really, in today's society, if Jesus were coming up here, he would probably not survive, and neither would Mary, because of the kind of care that we give people who don't have money and the kind of care we give specifically people of color, which and I'm not going to, actually, we're not going to go down that road of what Jesus is and what Jesus wasn't. This isn't about Christianity. It's just about, again, acknowledging the need for people of color and people with economic disparities to get proper care. And we have to change this, because this is a human rights issue. It's a issue for all human people. It's not just about one race over the next. We all should be getting care, because we all deserve to connect with one another and live our optimal best to help one another. So anyways, I'm going to get off my soapbox. I hope this message receives you well, and I hope you spread the message in some form or fashion. Feel free to comment. I don't care if people want to dismiss what I'm saying, go with what I'm saying. It's all up to you. And I hope you have a good rest of your holidays, and I hope we bring in 2020 with more compassion, collaborativeness, inclusion, equity, whatever else you have in your heart. I hope we are bringing that into 2020. Have a good rest of the day.